Want to pass your NCLEX? Then let's get started. Today we'll be covering 10 questions on health promotion and maintenance. Question 1. A nurse is conducting a health promotion session for a group of adults. Which activity is an example of primary prevention? Administering influenza vaccine to elderly individuals, providing smoke cessation counseling to smokers, teaching parents about safe sleep practices for infants, screening adults for hypertension. Pause the video and select your answer. If you chose option C, you are correct. Teaching parents about safe sleep practices for infants. Primary prevention aims to prevent the occurrence of disease or injury before it happens. Teaching parents about safe sleep practices for infants, such as placing babies on their backs to sleep, is an example of primary prevention because it aims to prevent sudden infant death syndrome. You can pause the video and go through the incorrect options. Question 2. A pregnant woman in her third trimester is advised to take prenatal vitamins containing folic acid. What is the primary purpose of folic acid supplementation during pregnancy? Preventing neural tube defects in the fetus, preventing gestational diabetes, reducing the risk of preterm labor, preventing maternal anemia. Pause the video and select your answer. If you chose option A, you are correct, preventing neural tube defects in the fetus. Folic acid supplementation during pregnancy is crucial for preventing neural tube defects such as spina bifida and anencephaly in the fetus. Question 3. A community health nurse is conducting a health promotion program for a group of older adults. Which intervention would be most appropriate to promote healthy aging? Encouraging regular physical activity, providing information about treatment options for osteoporosis, screening for colorectal cancer, administering influenza vaccine. Pause the video and select your answer. If you chose option A, you are correct, encouraging regular physical activity. Regular physical activity is essential for promoting healthy aging and maintaining mobility, reducing the risk of chronic diseases, and improving overall well being. Question 4. A school nurse is teaching a group of adolescents about the risk of substance abuse. Which approach is most effective for preventing substance abuse among adolescents? Providing information about the dangers of substance abuse, teaching refusal skills and peer resistance strategies, implementing random drug testing in schools, encouraging parental supervision and monitoring. Pause the video and select your answer. If you chose option B, you are correct. Teaching refusal skills and peer resistance strategies. Teaching adolescents refusal skills and peer resistance strategies empowers them to make healthy choices and resist peer pressure to engage in substance abuse. Question 5. A nurse is conducting a health promotion session for a group of adults. Which activity is an example of secondary prevention? Providing nutritional counseling to individuals with diabetes, conducting mammography screening for breast cancer, administering hepatitis B vaccine to healthcare workers, educating parents about car seat safety. Pause the video and select your answer. If you chose option B, you are correct, conducting mammography screening for breast cancer. Secondary prevention focuses on early detection and treatment of disease to prevent complications. Mammography screening for breast cancer aims to detect cancer at an early age when treatment is more effective. Question 6. A nurse is providing anticipatory guidance to parents of a toddler. Which recommendation is essential for injury prevention? Teaching the child how to swim, supervising the child closely near bodies of water, ensuring the child wears a helmet while riding a bike, administering age appropriate vaccinations. Pause the video and select your answer. If you chose option B, you are correct. Supervising the child closely near bodies of water. Supervision near bodies of water is essential for preventing drowning, a leading cause of injury related death among toddlers. Question 7. A community health nurse is working with a group of adolescents to address the issue of teenage pregnancy. Which intervention is an example of primary prevention? Providing prenatal care to pregnant teenagers, distributing condoms and contraceptive information, implementing comprehensive sex education programs, offering parenting class to teenage parents. Pause the video and select your answer. If you chose option C, you are correct. Implementing comprehensive sex education programs. Comprehensive sex education programs aims to prevent teenage pregnancy by providing adolescents with information and skills to make informed decisions about sexual health and behavior. Question 8. INIS is conducting a health promotion session for older adults. Which intervention is most effective for preventing falls in this population? Providing medication management education, recommending regular eye exams, encouraging participation in Tai Chi or balance exercises, educating about the importance of a healthy diet. Pause the video and select your answer. If you chose option C, you are correct. Encouraging participation in Tai Chi or balance exercises. Regular participation in Tai Chi or balance exercises can improve strength, balance, and coordination, reducing the risk of falls among older adults. Question 9. A nurse is caring for a pregnant client with gestational diabetes. Which intervention is essential for promoting optimal fetal outcomes? Monitoring blood glucose levels regularly, encouraging strict dietary restrictions, administering insulin as prescribed, recommending bed rest for the remainder of the pregnancy. Pause the video and select your answer. If you chose option A, you are correct. Monitoring blood glucose levels regularly. Regular monitoring of blood glucose levels is essential for managing gestational diabetes and promoting optimal fetal outcomes. Question 10. INIS is providing health promotion education to a group of adolescents. Which intervention is most effective to prevent STIs? Encouraging abstinence from sexual activity, providing condoms and contraceptive information, promoting monogamous relationships, educating about the importance of regular STI screenings. Pause the video and select your answer. If you chose option A, you are correct, encouraging abstinence from sexual activity. Abstinence from sexual activity is the most effective method for preventing sexually transmitted infections among adolescents. Click that subscribe button and join us next Wednesday.